What if you could see better at every distance and get rid of your cataracts at the same time? Dr. Jeffrey Whitman this morning is here to help people do exactly that. And Dr. Whitman from the Whitman Eye Center joins us. Good morning. How are you?
Good to be here this morning.
Good to have you here. I always like seeing you. Okay, you're here today to talk about an option your patients have to reduce dependency on glasses for near, far, or in between, as well as treating cataracts. That's a lot.
And Jane, what you're talking about is our Symphony lens implant. And it's designed to not only take care of the cataract, but again, decrease that dependency on having to wear glasses for distance, computer distance, and reading up close. And it can do that, and it treats astigmatism at the same time. So it's become our most popular high-tech lens that we use in the office today.
Okay, and we have a graphic that we're going to show right now. This shows what people who have cataracts see. Can you explain?
Well, you know, the issue is that if you leave the cataract untreated, your vision can get this bad. It's not going to do that right away, but it can really decrease vision. Don't let that happen.
That's
my take home.
That's a good answer. That's a very good answer. Okay, so why do most people start developing cataracts as they get into their 50s and then 60s particularly?
Well, you know, part of that is an anatomical issue. The lens that sits behind the pupil of our eye gets harder, more dense, less clear as we get older. And first in our 40s, that creates the problem of, well, I can't read so well, and I need reading glasses.
Right.
But the natural extension of that getting harder and more dense is that we develop frank cataract in our 50s, 60s, 70s, and that can decrease our vision at any distance.
So how does someone know if it's time for cataract surgery?
Well, early on that can be a problem because it may be subtle changes. Perhaps you can't see street signs or the TV as well, maybe colors are more muted, but it can get as bad as that when you're driving at night, the glare from oncoming headlights is so bad that you really stop doing things at night, and that really shouldn't happen anymore.
I've heard people say that. So how does the lens replacement work?
Well, that's really part of the good news, because at Whitman, we're known as the cataract experts.
Right.
And we perform this surgery as an outpatient procedure at our own facility at the headquarters office. And we've made it really pretty quick, painless, and most patients, when they come in the next day, are already starting to see better.
Wow. So what does someone need to do
quick.
if they're watching this?
So if you're watching, you know, and you've noticed that your vision's starting to decrease, and particularly if you're 50 years of age or older, you need to call, set up that appointment, come in for a consultation, and if we find that cataracts are the problem, we'll be able to tell you whether Symphony is right for you or maybe one of our other high technology lenses to get you seeing better.
And you have offices all over the area. If you've just moved here, you may not know that, but you can find Whitman just about anywhere.
Correct. 6 offices in the Metroplex area. Our headquarters office off of Central between Royal and Forest. Just pick up that phone, give us a call, because at Whitman, we want to help you see better.
Nice to see you.
Good to be here.
Thank you. Okay. You can call 214-220-EYES to schedule an appointment, or just simply visit keywhitman.com.